Due to the sensitive nature of our story about the impact of the Memory Project, the patient and her son's names have been changed, and their story is told by actors. Sarah, the occupational therapist, appears as herself.
Mary was referred to us from the hospital. She'd had a fall at home and which had resulted in a tiny bleed, and the hospital had noticed that there was some confusion and memory loss. So Mary was referred to us for the memory team to assess to see if she was appropriate for our programme.
Well, what happened to my mum was she didn't seem to be herself. So it's hard to put your finger on, but she wasn't quite being herself. And then she had the fall. Well, we look back now and think that that actually hastened her dementia.
We looked at the functional assessments that the hospital OTs had carried out whilst she was on the ward and what her ability was there, and spoke to the family with regards to her ability before her admission to hospital, and therefore we came to the conclusion that we could help Mary at home by trying to regain these skills. We put together an individualised intervention plan for Mary which addressed her functional needs with regards to her personal care and meal plan preparation. So with Mary, we put in 4 calls a day for carers to call in the morning, lunchtime, tea time and back to bed call. So myself, as the qualified therapist and a carer, met with Mary at home on the day of discharge. The first thing that we would do as the occupational therapist is risk assess the home environment, and we look at any trip hazards or anything that Mary could fall over. For example, we removed all of the rugs. And then we would look at Mary's functional ability with regards to her activities of daily living. So we looked at her personal care routine and her washing and dressing routine and her meal preparation routine.
She explained that my mum would get 4 visits a day initially, and just to help her with a routine, you know, to get dressed and wash herself and that sort of thing, just to kind of remind her of what she would have done naturally before, you know.
With regards to Mary's intervention, we specifically used labels on food so that we could prompt Mary to look at the time that was needed to cook the meal in the microwave. We minimised distraction in order to prevent any confusion with Mary, and we gave Mary lots of prompting and lots of positive encouragement to re-establish that habit of cooking and habit of washing and the routine and structure.
What was interesting was that they didn't just do things for her. You know, when they went in, they got her, they helped her to do things for herself. They supported her in that way.
After a few weeks, Mary was doing very well with her meal preparation, and we were able to, first of all, stagger the calls and then cut them completely as Mary had re-established her meal preparation routine. Towards the end of the programme, Mary was able to do everything within her day except from she just needed a slight prompting in the morning with regards to her morning personal care. So we ended the programme with a long-term service coming in the morning to help her get up and get washed and dressed. Throughout the 6 weeks, we were able to keep in constant contact with her son and daughter-in-law, and this enabled them to also promote and use the strategies that we had put in place for Mary, which was great for Mary because it really helped emphasise the memory strategies and the use of the weekly planners and the prompting and the encouraging. Without the Memory Project, Mary probably would have stayed in hospital for a number of weeks after we assessed her, and all evidence points to the negative impact that this can have on functional ability.
I mean, obviously, she'll never be exactly the same as she used to be. But, you know, she's definitely working at the optimum level, if you like, you know, with the dementia. It's, she's got the carer going in once a day now, and, you know, with our care, it's like she's back.
Mary is a fantastic example of how invaluable the Memory Project is. When I first met Mary, she was really low in mood. She didn't want to go out and she didn't want to be included in any activities within her complex. By the end of the project, she'd regained her independence and her confidence, and the project had really empowered her, and she was, again, taking part in all the social activities within her complex, which was really great to see.